Tranylcypromine sulfate is a type of medication called an antidepressant, specifically a monoamine oxidase inhibitor. It works by helping to restore the balance of certain natural substances in the brain, which can improve mood and feelings of well-being. This medication is typically used for people who have not had success with other types of antidepressants. It is important to take this medication exactly as prescribed by your doctor. The usual recommended dose is 10 mg twice a day, but your doctor may adjust this based on your individual needs. It's best to take tranylcypromine sulfate at the same times each day, such as in the morning and at midday. It's important to follow your doctor's instructions carefully and not to stop taking the medication without consulting them first. Before we get into the details of tranylcypromine sulfate, it's important to note that you should always consult your doctor or pharmacist before starting or refilling this medication. This medication is typically taken by mouth, either with or without food, as directed by your doctor. Usually, it is taken twice daily, and the dosage will depend on your specific medical condition and how you respond to treatment. To minimize the risk of side effects, your doctor may start you on a low dose and gradually increase it. Once your condition improves, your doctor may work with you to reduce the dosage. It's crucial to follow your doctor's instructions carefully and not to take more or less medication than prescribed, or take it more often than directed. In order to get the most benefit from this medication, it should be used regularly at the same time each day. It may take several weeks for the full benefits to be noticed, so it's important to be patient and not to stop taking the medication without consulting your doctor. If you suddenly stop using this medication, you may experience withdrawal symptoms such as restlessness, confusion, hallucinations, headache, weakness, and diarrhea. To prevent withdrawal, your doctor may lower your dose slowly. It's important to inform your doctor if your condition lasts or gets worse, and to seek their guidance throughout the treatment process. Common side effects of tranylcypromine sulfate may include dizziness, drowsiness, tiredness, weakness, problem sleeping, constipation, and dry mouth. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. To reduce the risk of dizziness and lightheadedness, get up slowly when rising from a sitting or lying position. Remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Tell your doctor right away if you experience any serious side effects, including fainting, mental/mood changes, such as agitation, confusion, muscle stiffness, changes in sexual ability/interest, shaking, tremor, shivering, swollen ankles/legs, unusual weight gain, eye pain/swelling/redness, vision changes, such as double/blurred vision, signs of liver problems, such as nausea/vomiting that doesn't stop, stomach/abdominal pain, yellowing eyes/skin, dark urine, or seizures. Stop taking tranylcypromine and get medical help right away if you experience symptoms of extremely high blood pressure, hypertensive crisis, such as frequent/severe headache, fast/slow/irregular/pounding heartbeat, chest pain, neck stiffness/soreness, severe nausea/vomiting, sweating/clammy skin, sometimes with fever, widened pupils, or sudden sensitivity to light, photophobia. This medication may increase serotonin and rarely cause a very serious condition called serotonin syndrome/toxicity. The risk increases if you are also taking other drugs that increase serotonin, so tell your doctor or pharmacist of all the drugs you take. Get medical help right away if you develop symptoms such as fast heartbeat, hallucinations, loss of coordination, severe dizziness, severe nausea/vomiting/diarrhea, twitching muscles, unexplained fever, or unusual agitation/restlessness. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, dizziness, or trouble breathing. If you notice other effects not listed above, contact your doctor or pharmacist. Antidepressant medications like tranylcypromine sulfate are used to treat depression and other mental or mood disorders. They can help prevent suicidal thoughts and provide other important benefits. However, it's important to be aware that some people, especially those younger than 25, may experience worsening depression or other mental/mood symptoms when taking antidepressants. It's crucial to talk to your doctor about the risks and benefits of taking this medication, especially if you are younger than 25. If you notice worsening depression, unusual behavior changes, or other mental/mood changes, be sure to tell your doctor right away. This medication may also rarely cause extremely high blood pressure, which can be fatal. It's important to monitor your blood pressure regularly and to be cautious about food and drinks that contain tyramine, as they can increase the risk of high blood pressure. It's also essential to discuss any other medications or herbal products you are taking with your doctor before starting tranylcypromine sulfate. Be sure to ask your doctor before starting or stopping any other medications while taking this drug, as it can still cause interactions for a period of time. Before taking tranylcypromine, make sure to inform your doctor or pharmacist about any allergies you may have, as this medication may contain inactive ingredients that could cause allergic reactions. Also, be sure to let them know about your medical history, especially if you have conditions such as high blood pressure, heart problems, mental/mood disorders, liver or kidney disease, or if you have diabetes. This medication can make you feel dizzy or drowsy, especially when combined with alcohol or marijuana. It's important to avoid driving, using machinery, or doing anything that requires alertness until you know how this drug affects you. Also, if you are planning to have surgery or any procedures requiring contrast dye, be sure to inform your doctor that you are taking tranylcypromine, as you may need to stop taking it beforehand. If you have heart disease, be aware that this medication may mask chest pain, so it's best to avoid strenuous exercise while taking it. And if you have diabetes, tranylcypromine may lower your blood sugar, so be sure to monitor your blood sugar levels regularly and communicate with your doctor about any changes. For older adults, it's important to be aware that they may be more sensitive to the side effects of this drug, especially when it comes to its effects on blood pressure. If you are pregnant or breastfeeding, it's crucial to discuss the risks and benefits of using this medication with your doctor, as it can pass into breast milk and may affect the baby. And as with any mental/mood problems, such as depression, it is important not to stop taking this medication unless directed by your doctor. If you have any concerns about using tranylcypromine during pregnancy or if you are planning to become pregnant, be sure to discuss this with your doctor right away. Are you or someone you know taking tranylcypromine sulfate? If so, it's important to be aware of potential interactions with other medications and substances. Some products that may interact with tranylcypromine sulfate include other antidepressants, appetite suppressants, drugs for attention deficit disorder, certain drugs for high blood pressure, certain opioid medications, certain drugs for Parkinson's, street drugs, stimulants, and more. If you are taking other drugs that increase serotonin, you may be at risk for serotonin syndrome/toxicity when taking tranylcypromine sulfate. Examples of such drugs include certain antidepressants, street drugs, and certain opioid medications. It's crucial to inform your doctor or pharmacist if you are using any of these medications, and to discuss how much time to wait between starting or stopping any of these drugs and taking tranylcypromine sulfate. Additionally, tranylcypromine sulfate can cause drowsiness, so be cautious if you are taking other products that also cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, or drugs for sleep or anxiety. Check the labels on all your medicines, as they may contain ingredients that cause drowsiness. It's also important to follow special dietary restrictions while using tranylcypromine sulfate in order to limit the amount of tyramine in your diet. Avoid consuming large amounts of caffeine-containing beverages and large amounts of chocolate, as they can increase the side effects of this medication. Foods and beverages high in tyramine, such as aged cheeses, certain meats and fish, and certain alcoholic beverages, should be avoided while you are taking this medication and for at least 2 weeks after you stop using it. Moderate to low tyramine content foods should also be consumed with caution. Lastly, be sure to contact your healthcare professionals right away if you notice symptoms of high blood pressure, such as fast/slow heartbeat, vomiting, sweating, headache, chest pain, sudden vision changes, weakness on one side of the body, or trouble speaking. Always consult with a healthcare professional for more information and recommendations for your diet. If someone takes too much tranylcypromine sulfate and has severe symptoms like fainting or difficulty breathing, they should call 911 immediately. Otherwise, they can contact their local poison control center for assistance. In the US, residents can call 1-800-222-1222, and in Canada, residents can call their provincial poison control center for help. It's important not to share this medication with others. Your doctor may also request lab and/or medical tests, such as blood pressure and liver function tests, while you're taking this medication. Make sure to keep all your medical and lab appointments and consult your doctor for more details. If you happen to forget a dose of tranylcypromine sulfate, take it as soon as you remember, unless your next dose is scheduled within 2 hours. If that's the case, then just skip the missed dose. Take your next dose at the usual time. Do not take a double dose to make up for the missed one. When it comes to storing tranylcypromine sulfate, it's best to keep it at room temperature and away from light and moisture. Avoid storing it in the bathroom and always keep it out of reach of children and pets. When it's time to get rid of the medication, make sure to properly discard it when it's expired or you no longer need it. You can consult with your pharmacist or local waste disposal company for the best way to dispose of it. Remember, don't flush medications down the toilet or pour them into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.